Hey gang! So I'm JJ, you know that, and I am here at my favorite physical therapy clinic, Renew Physical Therapy in downtown San Francisco, with my awesome physical therapist, Dr. Mark.
Welcome.
And Dr. Mark, I actually met him because he helped fix my husband's shoulder a couple of months ago, and he was like, I was complaining about my neck, and Peter was like, you should just go see Mark, and I was like, yeah, that's a good idea. And he did such a good job fixing my neck and helping me press overhead that now we're working on making me marathon ready, but that's another story. I was in here working hard. I sweat so hard when I'm in here. PT is not for the faint of heart. And I saw that Mark was using these BFR blood flow resistance or occlusion training cuffs. I actually have these cuffs, and I've written on my website and shared on social media in the past about how you can use blood flow resistance training, which we'll talk a little bit about in a second, for like meathead type stuff, like just strict hypertrophy, like I want big arms and big quads, and we've talked about that before. But I was like, what are you doing with these things? Like, these are for meatheads, and like, this is physical therapy. And he was like, you don't know a lot of things. And so I'm here.
A little nicer now.
A little bit nicer now. He's nice now. Look, he's a nice guy. So I wanted to do an update, to talk a little bit about what the clinical modalities and approach is, and how you guys use these here, outside of meathead, big bicep type stuff.
Definitely. Yeah, like a lot of tools in physical therapy, there's usually like this kind of like early adoption of this tool that doesn't have like a lot of research at first, but just has like early research of like, oh, this could be really useful, and like either like in Eastern medicine practice or something else will use it without a lot of like research behind it. And then blood flow restriction training is one of those tools that was used for a long time. They call it Katsu training. And now basically there's all this research that's just exploded in the past few years. So they have like a graph just recently, like if you look at the graph, it's like you have like the research studies from like 10 years ago, it's like down here, and then you see like all of a sudden the past like 5 years goes like this. And so all of a sudden what they found out is that blood flow restriction training is very safe and it's very, very effective for very specific uses, but then also can help out pretty much anybody that's applied to. And it varies in degree depending on your situation, your injuries, or whatever's going on with you.
So we can use these cuffs, which we'll show in a little bit. Like I mentioned, not only like just get big muscles, but here in PT or even on your own in a more functional, what we call in like the training world, functional training, to help recover from an injury or just to generally like make your joints and your muscles like stronger.
Totally. So that's in PT. Blood flow restriction training is very valuable because a lot of times you have an injury and you just can't load your joints or load a certain tissue that is hurting and recovering as much. So like, let's say you have a tendinopathy or like a tendonitis, and you can only do like 50% capacity of that muscle group / tendon. You can get the full effect despite only training with a much lower volume. And this can actually have positive effects on all the tissues, not just like muscles. Because at first they're really looking at like, how can we just maximize hypertrophy, which obviously blood flow restriction training can do, but it can improve tendon elasticity, even bone density. There's all these changes in hormones that create all these effects in your body. It's basically just taking all the effects of exercise and just maximizing it. So it's very interesting.
That's cool, because like when I would explain it to people in terms of like just strict hypertrophy, like building muscle, I'm like, it's lovely. It's a way, like if you can't, in the absence of just lifting the heaviest thing possible. So even if you are, like say you are someone who had like a bicep injury, like a bicep tear, that's fine now, and you're cleared to lift, but you've noticed like you just don't feel comfortable lifting like 45, like I curl 45s, but not really. You know, curling 45-pound dumbbells to get that muscle growth. Right, I would always recommend blood flow resistance training because you put the cuff on, which we can show in a little bit, and you cut the weight down. You intentionally lower the weight, right? So maybe if you used to do 45, like even like 15 or 20 or whatever, wherever you are, but a much lighter weight, and with the cuff on and creating that tension, doing like higher rep work. So in the absence of being able to lift like as heavy as you perhaps want to, it's a really nice way to still get the same benefit as lifting heavy, but lifting with less weight if you're dealing with an injury or any kind of issue.
Definitely. And there's all these other benefits that they just found out with it that like, you know, like usually if you're just lift really light weights, you'd be mostly just targeting the type 1 fibers.
Mm-hmm.
But you can't really get much of a response from the type 2 fibers. But with blood flow restriction training, it just like traps in all those metabolites and it fatigues out those the fibers so much that all the type 2 fibers get fatigued and the type 1 fibers. So you get like a response that is similar to that really high level or high load training like you talked about with very just minimal weight. The parameters is also much different because the response that you're trying to maximize with blood flow restriction is the metabolite buildup in the muscles. So everybody at Renew Physical Therapy, we're all certified blood flow restriction training, and so we learned there's like these different parameters that you can use and ways that you can use it that you just really just build up all those metabolites, and then you just get that muscle burn, and then after that you just try and keep that little bit of metabolite trickling in there, so you just keeps that response in there. And usually, like, you know, you lift heavy weights, there's this metabolite buildup, you have all the hydrogen ions in there, acidity, and you feel that muscle burn. As soon as you release the weight, it kind of goes away.
Right.
With this, it's like it just stays in there, and it starts to slowly release, but then you just slowly just kind of build it up, keep it up in there, and you just maximize that whole response.
Nice.
And yeah, it's just fascinating that not only does it affect the hypertrophy, but the strength and like the bone density, tendon elasticity, and all the hormonal responses. They've even they've been using it like there's kind of like some randomized controlled trials of some like other usage for sprinters. So they had like a group of sprinters that were running 100 meters, and basically they had one group. You can't train anything except for just 100-meter sprints for like a month or two, or I think it was like 6 weeks. And then the other group, you can't do any other training except for sprinting with BFR cuffs on, and then to a certain measurement. And then they compared these two groups. They looked at, you know, their tendon morphology. They looked at their quad size, the quad strength, and also obviously their 100-meter time. And you can imagine like the results here. And they're both, you know, going full intensity. The group of the BFR, they had faster 100-meter times, so an increase in force production, which is like very much like a neurological response. So there's basically, they're finding all this. There's a lot of really good data on like, okay, this is really effective, but I think as this research is just kind of exponentially going up, we're going to find more and more research that's showing just like how effective it is. And so far, it's looking like it's very effective and for uses beyond what we just thought originally, which was just hypertrophy.
That's cool. So you can build muscle, you can do physical therapy. Like if you have an injury, you can help repair or strengthen around an injury. And I like the sprinting example because I didn't even know that you can like train it doesn't necessarily mean you're broken or have an injury that you're trying to fix.
Yeah.
It has implications for training to get better at your sport.
Yeah.
Even in the absence of an injury.
Totally, and that's what I'm saying. It's like it applies to everybody. Like you can use it for performance, but you can also, in the physical therapy setting, we use it for people that can't load as much, and the results are very dramatic because all the studies, it's comparing against high load training versus low load BFR. But there's also research out there with low load training without BFR and low load training with BFR, which would be the equivalent of someone going through rehab that can't, they can't, like their knee is in pain, so they can't like load it as much.
Okay.
And so that the equivalent is like low load training, classic, physical therapy versus low load BFR, which BFR just blows it out of the water in every aspect. So this kind of translates to post-op ACL patients that usually they go through this like huge atrophy of the quad, just immediate. They just like lose all the quad muscle and they lose all their strength there. But you use BFR and it's like nothing ever happened. They just like jump right back into some of the higher level stuff once they're ready. And
well, since I have no injuries because I have a really good physical therapist, can we do just a demo just so folks can kind of see like how it works a little bit? And for someone like me, like I want to get better at running. That's like and that's so cool. Like one of the awesome things that I like about what we're doing now. I did have an injury that Dr. Mark and I were working on, and it's like the pain is gone. It's like it's managed, but now we're doing stuff that's just making me better at running. Like I ran 16 miles, which I haven't run 16 miles since I got hurt 4 years ago. So What if I wanted to use this modality to like in my strength training program to get better at running? What would I do?
Yeah, I would say for you specifically in this whole situation, you use it for two different things. First of all, and do you mind me kind of sharing?
Yeah.
Okay, so,
oh, please, yeah.
Yeah. So we have, one side, one leg that's weaker just due to nerve injury. So we have, so we still have like some lacking strength deficits on that side. So we could obviously just use some classic strength training parameters. And the classic one would be using like a set of 30, then 15, then 15, then 15. With like a minute break. It's lots of reps. And the first one is 30 reps.
Anything more than 10 minutes.
And so basically it's just like, you're doing just like light body weight, even just like supporting something with like a lunge, or like we're trying to work on like the calf, we could do like a knee drive calf raise against the wall to simulate the running mechanics and just kind of improve the strength there. The second use that would be really beneficial is aerobic training with these. And that's a whole nother subject. Because they actually found that you can improve your VO2 max with BFR 3 times faster than just doing normal cardio.
And so where do they put the like on their
legs?
Same like if I was going to do a squat, right? Like that's where you would put it there?
Yeah, you just always put it there. And that's a common mistake. You don't put it distal. You want to put it as proximal as possible, close up to the thigh, because that maximizes the amount of metabolic buildup in the leg.
And would they would like run with it, like jog with it? Yeah, so
you could jog with it, but most people can't really jog with it. There's a few patients that can jog with it, but you go.
I'm like, whoa, that's scary.
Yeah, so usually you could use a bunch of different ways. You can go on a bike.
Got it.
You could use a Stairmaster. You can do like a brisk walk on the treadmill is the usual application.
Walk on treadmill.
Yeah. Or like an uphill treadmill climb. You put them on, and it's you'll feel it right away.
Well, I think a lot of people. Let's do the leg one then. So, like Dr. Mark talked about, my residual. I fell like years ago, and a herniation, a bulging disc, like pressed on one of the nerves that runs down my leg. If you knew me back then, it wreaked havoc. Everybody knows that story. And but the nerve damage causes. It's like I'm real normal. I'm strong on the left, but like the right still lacks some of that strength. I'm just not as strong. So if we're going to use, let's just do an example of like where we would start.
Definitely. All right, let's throw these on.
Okay, and these are Saga, right?
These are actually air bands.
Air bands,
very similar to the Saga bands. It's like very similar design. So we just put this up here, and then I'll let you adjust this here. I want you to bring it up as far as you can towards the hip.
Wait, you don't want to do it? No,
but make sure that it doesn't restrict your movement.
Got it.
So you should be able to, if you do a full like deep squat, it shouldn't restrict your movement. Good.
Okay.
And then apply this one here. There we go. And you can tighten that up there.
I like how you do that.
And then go ahead and check it in the mirror. Make sure they're about the same height there.
Yeah.
Good. Deep squat. Feel good?
Oh.
All right. And then, let's see. Okay, we can use the iPad for this again. Phone.
Oh no, you said a lot of reps now. We'll just give a demo, Dave, are you going on a run today?
So like 25 reps?
That's 25, that sounds fair. That sounds fair.
All right. So the first thing we want to do is measure the limb occlusion pressure.
Okay.
So we take a little, let's see here.
So when you get these cuffs, it comes with an app and they're gonna create tension. And I mean, we could talk about that as well. It's kind of assumed, but for folks who might not understand, like you put the cuffs on, right? And then you want to tighten them, right? And blood flow restriction kind of explains what it is, right? Like you're trying to trap as much blood into that muscle as possible to do the fancy metabolite thing that you were talking about.
Basically what happens here is it fully occludes the venous system, so the veins, but partially occludes the arterial system. And the amount that it occludes is dependent on the exercise. So we can use for lower extremity 50 to 80%. And it's a very specific amount. Because if you do too much, you completely occlude the leg and you can't exercise. And also it's dangerous. And then if you don't occlude enough, then you don't get the effect. And so that's why these fancy tools came out, and they're a bit pricey. But in the past, they used to just use bands or like these straps and just pull them tight.
Yeah, I had some of those. Like, it was like a tourniquet.
And they had early research of like, oh, this is like effective and safe. but then they kind of like looked into it further and they're like, this is not the way we should do this.
Got it.
So basically, this is safer and more effective.
Got it.
So let's go ahead and have you lay on your back here. I'm gonna have you relax your legs.
Love that. Love laying down exercises. Okay.
All right.
Oh no, are we gonna glute bridge? I'm scared.
No, this is just for the assessment. So we can
Okay.
Yeah. So I'm just
I was
going
like,
to...
oh no, I do think my clients would love to watch me have to do glute bridges.
Go here.
All right, so we're gonna get it, as Mark was saying, like figure out the right amount of pressure
Connected to my phone.
for the band to constrict to get like the percentage of occlusion.
Yeah. So I think it's connected to my phone, which is doing the video, so it's being a little bit funky here. I'm gonna try and connect, but we might just have to just do like one side.
Yeah.
Which is in our application. We could just do it on your affected side. Let's find out. But yeah, basically we find the total limb occlusion pressure. So we got it connected. So basically it's completely occluding, just like you're taking your blood pressure.
Okay.
Let's go ahead and relax the legs down. All right. And we'll calibrate.
Okay.
So it's gonna be on one side.
It hurts. No, I'm just kidding. I'm just kidding.
It's gonna completely occlude the blood pressure until it can't get any blood to travel through.
Okay.
And then it's going to take that measurement and it would take a percentage of it.
So it's gonna get real tight and then it's gonna loosen a little. Is that?
And it's going to completely loosen, and then I'll set the percentage, and it's going to slightly occlude to the exact percentage we want. We'll have you exercise.
Got it. That's something that, like, because I actually had a set of these. A company that makes them sent them to me, and I was like, I can count, but I didn't know. I don't unless. So that's the point. Like,
yeah,
it's a really great tool, but you do need some training to understand how to do it effectively. And me, not having been an expert, I was like, I think I put the cuffs on. I was like, well, this is cool. I want big legs, and I definitely made it so tight that I couldn't even squat. And so I just was like, screw this, and I sort of talked to them.
Yeah. So if you look here, we actually have this is the form that we go through.
Okay.
And basically, you have to go through all this, and then we go through this algorithm to find out if you're at risk for any issues coming up.
Got it.
It's pretty easy to pass this unless you have some of these kind of more rare kind of health conditions.
Got it.
And then they basically add up, and then there's a certain amount, and then you'd be at risk. And then it takes a little more in-depth look to see if you would actually be appropriate for
Got it. So don't just go buy them and futz around with them. Like, figure out, come down here and get shown how to use it, right?
Yeah.
And make sure it's safe.
So now
you
ready?
Right side, yeah. So that we did the left side.
So that took the total limb occlusion, which is for both sides.
Okay,
now we'll take that same percentage for both sides. So I'm going to inflate here, and then we'll click these. One side. Oh, is this one not going?
Not yet.
Let's wait 1 sec, and we'll do that again. Inflate.
Yep, we're good. Both of them. So
And
you have so much patience with the app. I'm like, never mind. Patience.
So we're going to go to 50% limb occlusion.
Okay.
And then I'll show you an exercise, and it's going to be working on kind of like that end stage of your gait cycle when you're running.
Okay.
And it's also going to work on the calves.
Okay. Oh, that sounds good.
Yeah.
I definitely need to do that.
All right, let's come on up.
Oh man, I never get to lay down. This is great. Oh god. Okay. Okay.
All right, let's sit up against the wall like this.
Okay.
Get a little bit of a lean here.
Okay.
And just like with running, we should have a slight forward lean.
Okay.
We're gonna reach 1 foot back, bend the knee like this.
Okay.
And then I want you to come up high knee and a calf raise.
On my weak side calf.
And then come back down and reach back. That's rep 1. Let's get to 30.
Oh my gosh.
So what are you experiencing right now with this?
It's still, years. Oh, well, the humility of being.
Come up all the way, hip extension, knee extension here.
Oh, gotcha.
There we go.
Gotcha.
Good. Left knee all the way to the chest.
Oh,
All the way
gotcha.
up. Good. For this full extension.
It still is.
Full extension, full extension, full extension. There you go. So instead of just targeting the specific muscle group, we're also affecting the motor pattern here and trying to implement it into your sport, which is running.
I do love that. I talk in training about like
Full knee extension.
motor patterns and such, and some of the stuff that I've learned here like reminded me of how important that is, and I've been doing some of that stuff with my clients. Like, no, they're not injured. It's just, everyone sitting at a desk kind of doesn't move that great anymore.
Yeah, totally.
And incorporating like some of that arm swing stuff.
Yep. There we go, the extension.
Oh, that is so hard.
Yeah, so you see it's like over time, you develop compensations and you lose this propulsion phase while you're running.
Yeah.
And from what I understand, you talked about how you lost a lot of performance when this injury happened, right? Well, you're probably not getting a lot of propulsion out of this side. Okay, you need a break?
That might be all that leg's got.
How many reps did you get there?
I'm gonna say like 17.
17. Why don't we get 17 on the left
Okay,
side?
that sounds good. Oh, this side will be fun. Okay. Oh, that is like.
And so the parameters that they chose in the research was 30, 15, 15, 15. And that is usually the standard of what you use, but in practice, there's all kinds of parameters that you can use, and we adjust and adapt based off what's going on. Like obviously, you're not going to get the 30 reps without compensating.
Yeah.
And really, those parameters were chosen in the research so they can have homogeneity. So it's basically all the research can be the same, so they can have more powerful research when they combine them together. Instead of just having like everybody's using their own parameters, it's weaker research. But the one thing that they haven't researched is which parameter is better. So what's interesting is, and what I'm really excited for, is looking over time to see if there's even better parameters. And if you just look at the concepts, basically we're trying to build as much metabolite buildup as possible into the extremity, and then after that, we just try and maintain it over time. Then you can kind of tinker with things based off those, based off the theory. So how are you feeling on the left side? You get to 17?
Oh yeah, I got two more. And it is interesting, like, it's funny when you asked me how do I feel, I was like, I want to use feelings, you meant physically. But while I was doing this, it is humbling for me to, like, first off, I'm like after 17, I like literally after a while, like this calf, there's just no, the nerve just is not as, it's just not as strong.
Yeah. That's hard to do.
But I was like thinking, two things jumped to mind. I'm like, so like after like 17, I can't do this anymore. But I ran 16 miles without pain. Like that's cool. Like the body is so cool at like, so it was interesting when you asked me how I feel. Like so many of my athlete clients, they get injured and there's like negative feeling. Like I'm garbage. My body sucks. Like there's negative talk about your body. Like my body sucks. My injury sucks.
Yeah.
And I'm like, okay, like I got this nerve damage down here, but I'm still gonna like run. Yeah. And then so it's cool. Like the body can figure out a lot of things, but obviously we want to make it even better, and even like you just want to make it better. And so while I was doing it, at first I was like, oh my god, I didn't realize just how how much more strengthening I have to do on this side.
Yeah.
I can only do 17 kind of less than perfect calf raises, right? But then I'm like, well, but the application is so perfect because like I can only do 17. That's not a lot.
Yeah.
But getting like what the occlusion training gives me is like extra credit for those 17. It gets like doing it without it, I get like X, but doing it with it, I get X times whatever the clinical research says, like the improvement did. So for someone like me, I'm like, oh, I need to be doing that.
Yeah. And then also just seeing this, session number 2, be like, okay, you can get 17 reps. Maybe we have to regress this even further. And then we can get something with 30 reps. And then basically you'd have the equivalent of you doing the full knee drive for 30 reps, even though you're doing like a regressed version of it.
Can you do like, I'm pretty sure that I know the answer, but like eccentrics with it too, like.
Totally.
Cool.
Yeah, there's a lot of applications. You ready for set number 2?
Oh, what? Again? We'll see. All right, let's see how many this.
What's interesting to talk about with like the beliefs that come up after an injury. And basically it can shape just the way that you view the body. And there's a huge effect. Let's go ahead and get full hip extension, knee extension here. There we go. Good. There is a big effect that happens on your psychological health after an injury, and it's a huge part of getting over an injury, is getting through that psychological part.
That's wild.
Let's get one more here.
9.
Get full.
Oh my god, that is so hard. That is so hard. It's so hard.
All right, let's get the other side.
But it is, I will say, you asked how I feel too. It is comfortable. Like I know when I was futzing around with them a couple of years ago, like I didn't know what I was doing.
Yeah.
And I put them on and it was so tight, like I was like, I can't, like how am I supposed to squat with this? And like this, I can, like the 50% is, but I don't know what I did. But
Yeah.
it was definitely more than 50%.
They actually did a study where they looked at basically they looked at like the results of the BFR versus non-BFR, and they had obviously they did looked at strength, and they found pretty amazing results with the BFR, of course. But they also had all the participants rank how hard was the training with BFR,
Okay.
and then you had the other group, how hard was your training without the BFR.
Right.
And the group that did the BFR that had the phenomenal results ranked their training to actually be easier than the people that were doing high level equivalent strength training.
Huh.
Yeah.
Well, I'm sold. I'm gonna have to kick the dust off mine and come bother you to show me how to do more stuff.
Totally, I can do that.
Anything else that we should talk about before we wrap up? I mean, so far the applications that we talked about, obviously muscle growth, like sports and in sports and post-op and
Preventing
injury.
atrophy, especially like tendon health, bone density. So you think about the elderly population, and obviously if you're not able to load your joints to your full capacity because of injury, then obviously getting over injuries and muscle hypertrophy, but also strength. There's just so many applications. They even use it in comatose patients. They throw them on there and they just passively move the leg, and they find that they have less atrophy on the side that they do that with than the other side that they just move the leg without BFR.
Huh.
So there's all these applications that are just useful with the BFR.
Well, cool. Normally when I do stuff, I say, give me a call and I'll help you out. But you can call me and I'll just send you to Dr. Mark to help figure out how to use it. So thank you guys. I really appreciate you taking some time to play with me today. And I will see you next week to fix my stuff.
Sounds good.
Thanks. Appreciate it.
Of course.